Guru Ameen, the mad scientist, with a quick thought of the day for you on exactly why UGL dosages of trainers and coaches that recommend UGL dosages seem to be so much higher than people who are running Pharma gear. Okay. This is where I believe this all comes down to. And this may be more theory than fact, but there are a lot of things in what I'm about to say that do line up very clear with the time that we are right now. Since President Trump's elected presidency, believe it or not, it has been more difficult for packages that would be seized, containing controlled substances like steroids. They've been much more difficult to come through the customs. I have clients that use services like MAPS gear and things like that, and when they do, sometimes they tell me, some packages may have gotten seized. And this has been happening quite a bit in the past year. It's more so than I've noticed before. And so I'm going to have to draw to the same conclusion that unless somebody's having it brought here by boat or by Pelican or something like that, bird carrier service, that whoever the UGL maker is still getting the supply from somewhere that has to come through U.S. Customs by entry of mail or port. This is the way things get into the country for the most part. So if that's the case, then that means those guys' packages are probably getting seized too. Logic would tell you that. If security's increased and legitimate drugs are getting seized, then obviously other drugs are too, because they have different ways of testing the stuff now. They don't even have to open the package. They use frequencies and stuff. It's crazy. But anyway, they're detecting this. And by the way, they don't need dogs because dogs don't detect steroids. So let's not get into all that. It's not about dogs. It's other things that they're using where they don't have to even open the package or have a dog smell it and they can tell what's in it. So these packages are getting seized. Now, the UGL dealer is not going to tell you if that is going to interfere with the tremendous amount of orders that he has, because all the people that were getting stuff from Napscure or whatever that were ordering it from out of the country are getting their packages seized. So then they turn to the closest UGL guy, and here's where everything changes. This guy's packages probably got seized too. So he takes whatever kilo of whatever stuff he has left, whether it's trenbolone, testosterone, whatever, and guess what, guys? I got news for you. That guy's doing the same thing that they did back in the 80s. He's cutting it, okay, to make it stretch further. And then you are being told you have a tolerance because you're partying all the time. You're taking too much, so you need to take more. This is a tactic that has been used by drug dealers since the dawn of history. It's nothing new. It's a technique where you start off with a higher dose and you get people used to it, and then you tell them that their dose needs to increase, but you're decreasing the effectiveness or the potency of the drug that you're pushing onto people. Now, what is the result of all this? The result of all this being that this stuff comes from America, because if you're over in a country like Iran, let's just say, or Kuwait, you can walk into or even Mexico or whatever, Asia, you can walk into a pharmacy and you can buy these drugs. They're not controlled. But in America, they are, which allows for a larger black market. Now, some people on the internet who can find these things and get them, without having the packages get seized, they will maybe then look on the internet, on the forums, for those people taking the UGL dosages and see the dosages that they're taking of the watered down stuff, the stuff that's cut. And because so-and-so's coach, or maybe the client won, and so that client had so-and-so for a coach of, team inject 1 liter or whatever it is, then what ends up happening is that information becomes available. And then people automatically think that that information is valid because that client won, that coach is reputable, and that coach is referring people to a reputable source. I invented this game, guys. That reputable source gives you kickback. That's the way it works. So you're going to keep referring people to this reputable source, and these people really don't have a clue now what's in their reputable product, which leads to a lot of irreputable doses. They're not real. People think that they're taking all these drugs, but they're not. Back in the 90s, I mean, if steroid milligram dose is the same, and the UGL guy is putting out the same as the American stuff that was out, back in the day, if you had Syntex Anadrol, the 2902 Anadrol was labeled on the back of the bottle, on the back of the tablet, and if you attempted to waste your time, by the way, and try to take 3, you would be extremely sick, worst headache in the world, very, very nauseous feeling, you wouldn't be able to eat, your blood pressure would raise, and you would get toxicity. I mean, extremely fast. And some people would actually get nosebleeds. I mean, they could have unstoppable, controllable nosebleeds from the increase in red blood cell count. So profound with this drug. And now you have people saying, take 100 milligrams of this every night and take 80 milligrams of this every day. And then on top of that, take this much tren of this ester, and then tren of that ester, and then this type of testosterone from this ester, this testosterone, this ester, and then on top of that, the growth and the insulin and all that. But, we're forgetting that these dosages aren't representing the real milligram dosages of the drugs of the pharmaceutical companies. Why? Why is it that you can test the drug? Okay, it may be positive, like there's a lot of testing kits out there. Dave Palumbo's got a good one, so I'll give him a lot of props for that, because it allows people to at least identify whether or not there is any active substance in it whatsoever. But it doesn't really tell you what the milligram strength is, and here's the kicker. When people order powders or kilograms of raw solvents and make them themselves in America, and they order it from another country, the purity of that drug is questionable. It's not the same purity as if it was made by a real multi-million-dollar pharmaceutical company that has the budget to actually make the drug under the right conditions, of which the chemicals that they're using are of the highest purity. They're very pure. So, for example, 50 milligrams of an unpure substance is still 50 milligrams, but 50 milligrams of the same substance with a higher purity has less impurities, which means it's a higher grade of a 50 milligram drug. So you may ask yourself, well, does that really matter? Okay, well, in a lot of ways, some people can't really understand what I'm saying, so I'll relate it to you in ways of common knowledge. Alcohol. Shitty quality alcohol like moonshine or stuff like that may have lead or other impurities in it still have a high concentration of alcohol, but it has other things in it which are very harmful to you. This is the exact same thing with steroids. They may have the right milligram dose, but there are other things that could possibly be harmful to you, and they could potentially affect the timing and onset of the drug. And this may have to do with the binders, or it may have to do with the quality and the purity of the actual ingredients that the drug is made from. Okay? So what I want you to understand is that when you see a program out there and you see high levels of gear on it, and you see this guy who just wins a local show, and you think that that level of gear is what's needed to win a local show, please take a step back and look into the amount of drugs that you're taking with some caution, and understand that just because someone else did it, it doesn't mean that it's right. It also doesn't mean that it works just because they're standing there and they're won. We don't know what the other effects were. We have no idea what the blood test results are. And the trophy doesn't mean that they're a trophy of good health. It just means that they won their show. It doesn't even mean we know who they competed against to know why they won their show. So it's not a representation of the cycle that the person took. What we can know and do know for sure is if the drug is being tested, and we know that it's 50 milligrams of a certain substance, and the pharma grade is 50 milligrams of a certain substance, we both know that they're 50 milligrams. The question is how come they don't work the same? They don't. We know this is true because if you were to take the drugs that were prescription in America, they're not the same as the UGL stuff. So we have to question why. When we start thinking about it logically, you start understanding that not everything is tested after the fact. Some people get bottles, put it on forums to say that it's tested, but it's not always a guarantee to prove that it came from that batch if it's a UGL. A label is very simple to make. You just print it. So there's really no identifying whether the batch that you have is from the batch that was tested and put on a forum. What we do know is that when you do get something pharmaceutical, if it's real, there's a reputation behind the company, and we know that the product has been tested by the FDA or other regulatory systems, which ensure that the drug is safe and quality consistent for human or animal consumption. This is a fact. Please look into the drugs before you use them wisely, and not just because someone else tells you how to take something that could potentially harm you. Thank you, and until next time.